moisturizing the skin, taking off the stratum corneum. It's infusing the skin with different serums. We have Lumixil, which is for topical brightening, for melasma, hyperpigmentation, acne, scars. It's really great for that. Vitamin C, somebody who's been in the sun too much or just, likes that treatment. Skin clarifying, which is the salicylic acid, and that's also what we use with our pore clarifying brush, which actually scoops inside the blemishes and sucks out all the dirt, as well as brushing it with a brush head, as opposed to the diamond tips, which we kind of say watch out with active acne. So this would be a better choice for that.
Yeah.
And then skin hydrating, which is what I'm going to use today. It's kind of our basic hyaluronic acid, but most times when you see hyaluronic acid in a moisturizer, it doesn't actually penetrate the skin because you haven't taken off that layer. So what I'm going to do today is use the hyaluronic acid with the 100 grit tip on her. So how this works, it's very easy. It's a screw-in tip. So this is the 100. Screws in, super easy. And then we take one of our plastic tips, which they come with every order of the serum that you do in the 12-pack orders. Comes 12 opticides, because we recommend that you clean in between every patient and use one of these per patient.
So completely disposable, one per patient.
Yes, and we give them to you, so it's there's no reason.
Or you don't clean them; you just throw them out after you're done.
Just throw these out.
Don't recycle.
Well, you could recycle. I like eco-friendly.
Yes.
We
all should.
We definitely,
especially at this boutique.
So it's all been cleaned. The tray and the diamond tips completely autoclavable. We're all about hygiene here, as would any good boutique. So
absolutely,
there is no backwash from the waste jar. This is the opticide that was in there. I just cleaned the machine. There's no backwash into the machine. Once it's in that waste area, it goes straight in. There's no dirty stuff coming back onto the face, which is great. So this screws in. We have 3 ports on this machine. It's the treatment port, then a valve to switch to the opticide, and then the waste jar, and that gets emptied in between every patient. There's a little float, so you can't actually overfill it, because if you do, then it'll start backwashing. The float, it'll raise up with the water line, just like a buoy in the ocean. And so once it reaches a certain point, then it shuts the machine down. But definitely make sure you empty it, because it actually can turn on afterward.
Okay, so just empty it off when it's finished. That's
empty it off. All right. Yeah, absolutely.
Quick question. You might have mentioned this when you were here last. The infusion, is this very similar how it works to, like the oxygen intraceuticals infusion? I mean, I know obviously this is serums versus oxygen, but it doesn't work in the same...
Well, at home I was training